families, creating a lifetime of memories. Sadly, some families are denied these important moments due to the sad practice of alienation. These are families divided.
Hello, everyone, and welcome to another episode of Families Divided TV. In this episode, you're going to be hearing from Dr. Mary Alvarez. She's going to be speaking on reunification work for mildly and moderately alienated children. And the focus is going to be on the relationship between the child and the parent that is being rejected. When the alienating parent is allowed to remain on the sidelines, which he or she prefers, and isn't included in the overall process, less progress is going to be made between the rejected parent and the child. How to make sure that the alienating parent is included in reunification, as well as some strategies to increase their compliance with reunification, will be presented by Dr. Alvarez in this episode. We're going to also hear from Dr. William Burnett. He's going to be one of our guest presenters at our upcoming fall conference. It's an international fall conference. It's virtual, and it will be held in October, and it's October 13th through the 15th. This will be for 2.5 days. These presenters have some really awesome, bold, I might add, presentations that are much needed in regards to the abuse of alienation. So you're not going to want to miss this. This is not only for alienated family members, it's also very much for those of you who are professionals who work in the field of alienation. It's much needed. So I hope you'll be able to join us. We have many that have already registered and really are excited. It's going to be a 2.5 day conference. We're going to begin on Friday night. We'll be going Friday night, Saturday night, Sunday, and Sunday night. There's a promo on a video promo on our YouTube channel that explains into more detail, or you can go to familyaccess.info and check out all the information there. But so much is going to be included in this really great event, and I hope you'll go ahead and get registered. We're looking forward to it. So we're going to be back with Dr. Mary Alvarez and Dr. William Burnett right after these messages.
Divorce and co-parenting are a major life interruption for families, especially the kids, but also for parents and grandparents. And it's even worse in blame-filled, high-conflict cases. When parents engage in alienation by turning the kids against the other parent or grandparents, kids suffer. They're denied the opportunity to build the 4 big skills necessary for future resilience. New Ways for Families online class can help. Parents learn to use our popular BIF and EAR skills to calm the conflict and stop the hostile emails and texts. And we even have a class for kids and parents to learn together. Research shows a 75% improvement in joint parental decision-making after this course is taken, plus overall improvements for kids' well-being. Don't wait to make this affordable investment in your children's future and improve your well-being too. Start learning new ways for your family today at conflictplaybook.com.
Hi, everyone. This is Dr. Mary Alvarez. I am a psychologist in Austin, Texas, and I'm happy to be here with everyone to discuss what I feel is a very important topic. It is the topic of including both parents in any reunification work. This is counterintuitive to a lot of people because the favored parent seems to be in a good position with the child in the relationship, and it's the target parent that appears to need all of the reunification work. So I'm going to present evidence that I feel sways the pendulum to including the favored parent in treatment is more beneficial to the child than not. So as we move along, let me just give you a couple pieces of information about myself so that you know a little bit about my background and how I got here. I am a forensic and clinical psychologist, and my forensic work includes custody evaluations, formally, psychological evaluations, and reunification work for the family courts here in Texas. So I have a great understanding of how these family dynamics exist and how we can hopefully remedy them. So my focus today, though, is on mild and moderate alienation, or mild and moderate refuse, resist to a parent. It does not apply to the severe cases. So just want to make sure that everyone understands. So essentially, to set the background, we have an intact family. In the intact family, there were problems. There were marital issues, significant enough that eventually led to a separation and a divorce. When marital problems involve what we call psychopathology, especially one of the high conflict personality disorders, those marital problems continue post-separation and post-divorce. And in fact, those marital issues post-separation or divorce can be even worse. They can be exacerbated by a separation or divorce. So essentially, my point is the issues that existed in the marriage don't vanish when a family separates or divorces in high conflict situations. So what are we talking about as far as personality disorders? And I want to be very careful here that a parent doesn't have to meet the full diagnostic criteria for a personality disorder. They can have significant traits of this personality disorder and still be a very difficult person to interact with and deal with. So the three personality disorders or personality traits that we find in parents who have high conflict would be antisocial, the borderline, or narcissism. So we see these in intact families. Again, pathology doesn't develop in these ways post-separation or divorce. These are issues that were existing in the family during the marriage. So what do we see post-separation or divorce? We see the same personality traits. All right, we see antisocial behavior, borderline personality disorder or traits, and narcissism. So my point being, the same factors that existed in the marriage are almost always in high conflict situation, the same factors that exist post separation or divorce. So let's talk a little bit about what are the core features of each one of these as I move into my supposition that including, the favored parent is really the course of action for mild and moderately alienated children. So for antisocial personality, we have the following core characteristics: a disregard for laws and rules. The rules apply to other people, but they don't apply to that person. Deceit, lying, and exploiting others. Arrogance, intimidation, and hostility. That is the way that antisocial personality disordered people interact with others. Abuse, aggression, and rage are also other core characteristics. There's a lack of empathy or remorse. And these people can learn to say, I'm sorry, but there's a lack of ability to feel, that their behavior hurt somebody else. That's the empathy piece of this. And then they're irresponsible and often have a trail of legal problems because, again, rules apply to other people, not to them. And so following legal and lawful rules doesn't matter to them. So those are the core features of an antisocial personality. So what about the core features of someone who has a borderline diagnosis, or at least the borderline core features? Unstable. This person has very labile moods. Their mood rises up and down. They are often involved with self-harm behaviors, suicide, suicidal threats, attempting suicide, sometimes lower level self-harm behaviors like cutting, for example. The emotions that these individuals express are very intense, and they are out of proportion to the context, what's going on around them. Borderlines have a history of abandonment issues, and that plays itself out as an adult. They are constantly feeling that people are going to leave them, that they will be alone. And so there's a real desperate attempt to hang on to relationships, even though they are dysfunctional and unpleasant. And then borderlines have an unstable sense of themselves. So essentially, if you don't have a good sense of who you are, what you're made of, your morals, your ethics, and an overall well-developed sense of a person, then you essentially just morph into whoever you are around. So borderlines, if they're around somebody who's impulsive and carefree, they're impulsive and carefree. If they're around somebody who's more serious, they try and attempt to be more serious, but it's difficult for them. But my point being that lack of a sense of who you are and what you stand for is part of the borderline characteristics. And finally, the core features of narcissism. So narcissists are entitled. They feel that they are owed, that they deserve above and beyond what other people deserve. They are conflict oriented, as are the other two that I discussed, antisocial and borderline. But narcissists are definitely conflict oriented. And so any conflict in the marriage continues post marriage. They have little to no insight. And so trying to create a way for them to understand their behavior, how it's affecting others, where that behavior in themselves might have originated, they don't have that ability. They exploit others in situations for their own advantage. They absolutely do that. And then they require a lot of praise, compliments, adulation, attaboys, however you want to describe it. They are empty pits for ongoing recognition that they are good, great, special, important, etc. So that helps you understand the three most common high conflict personalities that we find in families who divorce but are unable to regroup and move on post-divorce in ways that are healthy for the children. So let's talk about this counterintuitiveness to including the favored parent in therapy. So you just separated or you just finalized a divorce, but there are continued high conflict parent issues that are affecting the kids. And worse, your children are starting to reject you at some level. And sometimes that happens in the intact families. You start to see those dynamics begin to take hold, but certainly post-separation and divorce. So if those are the factors in your life, why would you ever want to include the ex-spouse or ex-partner in the reunification process, as often ordered by the court? All right, well, let's go through some of the following. So number one, there were reasons that there was a divorce, obviously. Maybe you were physically or emotionally abused. That's a very common dynamic in these high conflict personalities. Maybe the other person does have a high conflict personality disorder, or certainly the core traits. Maybe you lost your sense of self along the way as you tried to over accommodate to the high conflict parent, and you lost who you are somewhere. And you never thought that you would have to deal with that person again post-divorce, save for the children, correct? Meaning there would be minimal contact, minimal interaction, minimal effects from that parent on you, towards you post-divorce. So I'm going to pause here and introduce why it's very important that we attempt to include that favored parent. This is what we want to avoid. So we know from research findings the following, and this is just a sample of the research, that children exposed to high conflict divorces are the following. 65% of these children had anxiety severe enough to require counseling or intervention. More than half developed an attachment disorder. Again, they were forced into the position to have to choose one parent over the other parent, disengage from one parent. So it affects attachment, that basic core that we have in our ability to connect with people and trust. Almost half of the children who came from high conflict divorces had fears and phobias that were abnormal, out of context, given their current life situation. 44% externalized the stress that they were feeling in the high conflict divorce, and they became physically aggressive. 31%, or about a third of these children, had sleep problems. So that's an indicator that the basic functions of that child's body were being affected. Sleep being a very important piece of growth and development for children. So what about the research for previously alienated children who grew up and became adults? Again, this is what we want to avoid post-divorce. So previously alienated children as adults, and the next following slides all came from the same research source, Verhaar et al. 2022. Depression and anxiety. These adults experience depression and anxiety more than half of the time. Eating disorder, body image problems. 20% of adults experience that. 40% of these now adults experience personality problems. The conflict affected their personality structure and development as well. What else do we find? About a third of adults experience suicidal ideation. 15% engaged in self-harm behaviors. And 10% experience what we call psychosomatic issues, which is an over preoccupation with your body, your health, what's going on inside your body, etc. It interferes in your ability to function on a day-to-day basis because of that over preoccupation. More than half of now adults experience alcohol consumption that started in adolescence. So that was a way for adolescents to deal with the conflict, through self-medication. About a third of adults engaged in drug use, specifically marijuana, and 10% of adults who were previously alienated as children have a sex addiction or pornography addiction. 45% of the adults experienced shame and guilt. And that's a very difficult piece of your adult life to find yourself in, because it affects your relationships across the board. 40% had low self-worth. So their self-confidence, their self-worth, their value of themselves, their importance in the world was all affected by the high conflict. 30% felt isolated and lonely post-alienation. Helplessness was experienced by 20% of the now adults. Grief and loss, 60%. And that involves a lot of factors. Grief and loss related to a lost relationship or a significantly affected relationship with the other parent. For example, when children reach adulthood and they have the ability to more sophisticatedly process information and reflect backwards, they connect the dots and they see that what they experienced not only was that abnormal, but they see that it affected them, and they miss, what they should have had, what they should have had as children related to both parents. And then 45% of now adults deal with anger. I think that that's an expression of the grief and the loss and depression that's associated with the disrupted parent-child relationships that occurred in childhood and adolescence. And finally, 15% deal with some real abandonment issues as a result of being alienated. And half of these now adults have poor coping skills, as they navigate life as an adult. Finally, another study from 2012, same subject pool. These were previously alienated children who are now adults. What we find is 70% experience depression, and the baseline rate in our country, the United States, is 8% of the general population would meet the diagnostic criteria for depression, but 70% of previously alienated children meet the diagnostic criteria for depression. I mean, that's a very sobering statistic. 65% have decreased self-worth, which is consistent with the previous study I just presented. 50% are alienated from their own children. And so there's a multi-generational effect. 40% have trust issues because as children, they were pulled in many different directions and they didn't know who to trust except for the favored parent. But over time, as they developed and became more cognitively sophisticated, they understood in much more detail what had happened to them. And so it affects your trust. And then 35% of now adults struggle with addictions compared to our baseline population rate of addictions, which is 10%. So that's another sobering statistic that as adults, these individuals turn to substances to numb the grief, the pain, the loss, the depression, etc. So the previous few slides are my backdrop and in understanding why it's important to include the favored parent as much as possible when the alienation and the family dynamics are at the mild to moderate level. So, as a target parent, is this wrong to feel? So it's completely normal for a target parent to not want much, if anything, to do with the alienating parent. Completely understandable. I mean, that parent has made your life very difficult. That parent is developmentally and psychologically affecting your children. And watching that is heartbreaking, as the target parent. It's normal to only want a solid relationship with the child post-divorce and minimal contact with the other parent. Completely understand that, especially when that parent had the high conflict personality traits or disorders that I presented previously. And clinicians tend to focus on the relationship between the child and the rejected parent. That's a very obvious starting point for clinicians in the reunification process. That relationship is damaged. It's very obvious that it's damaged. And concurrently, the child's relationship with the favored parent looks fine from the outside to the untrained eye, to somebody who doesn't have experience with alienation and reunification. And so clinicians are swayed towards only focusing on the so-called problematic relationship, the target parent and the child. Why include the toxic parent in the process to heal and repair a relationship between you and your child? Now I'm going to start to lay the groundwork more specifically and how that actually looks. So just to remind you, high conflict personalities, antisocial, borderline, narcissistic, plus high conflict parenting, which is often the case in intact families and post-divorce, equals parental alienation in some of these families, quite a number of these families, but not all families. So knowing this, do you feel like running for the hills? Okay, I don't blame you if you do. But I'm going to ask you to please try and not turn your back and just run away and hope that all will end up okay in the end. I just presented significant and sobering research data that indicates that the children do not, in a lot of instances, weather this well when they become adults. But let's first of all talk about the cons of including the favored parent in the reunification process. So let's just go through and identify those first because they do exist. All right, so that person will likely be disruptive. They were disruptive in your marriage. They've been disruptive in the divorce process and post-divorce. They will continue any manipulation that you saw, again, in the marriage, during the divorce, and post-divorce. They will try and create ways to obstruct your process with the child or children, and they will continue to be your trigger. And so you know that the ways that that parent could push your buttons, so to speak, in the marriage, during the divorce, and post-divorce, that is still the case for you. So yes, these are all the cons, but are they are they reasons to not pursue including the favored parent? I don't believe so in most instances. So what are the pros of including the favored parent in the process. So essentially, that alienating parent doesn't just get to sit on the sidelines. And that's what's been happening, throughout most of this process, as the focus is on the parent who has the damaged relationship with the child or children. The entire focus is on that. And the favored parent just gets to sit on the periphery and watch everything unfold. Including them in the process makes them part of the process. The alienating parent's accountability can increase, especially with the clinician holding that alienating parent accountable for behavior change as well. And the overall picture to the children post-divorce is that both of you are still parents, that there's not just one person in charge and one person that the child looks to align with, that both parents have parenting roles for the children. So let me go back to triggers, all right, and help you understand in a little bit more detail what I mean by this. So just plan to be triggered by including the favored parent in the process. Just know that that's going to happen. Then you need a plan for your triggers because you already know that it's going to happen. You need to plan for it and practice. How are you going to manage those triggers? Everything that happened in the marriage, during the divorce, and post-divorce. All right. And discuss your limits and your boundaries with the therapist. In some instances, domestic violence is part of the equation, physical violence, for example. I don't expect a parent who was the abused parent in a physically abusive relationship to sit in the same room with the abuser. But there are options such as Zoom, where you don't have to physically be in the room, but still requiring that favored parent to participate and be part of the process. But the clinician is responsible for creating a safe environment, for you. So I just wanted to clarify that. So what do I feel is the role of a clinician by including a favored parent? All right. These are the things that I feel are important. These are the things that I practice in my own work, reunifying parents and children. So I am a strong advocate for creating from the onset a moratorium on history. It is not the clinician's role to go backwards in time and unpack all of the things that happened in the marriage that went wrong, all of the transgressions that happened during the divorce and post-divorce. All right. That only allows the high conflict parent, the favored parent, to, again, take charge of the entire clinical process. And they're happy to do that because then it lets them off the hook as far as their own responsibility and their own behavior in this entire clinical process. Child focused. Again, this is not post-divorce counseling. This is child focused reunification work. Forward progress emphasis. And that moratorium on history, you have to, as a clinician and as a parent, be very firm in not allowing things to transgress and for superfluous information to be constantly introduced into the process. In my opinion, education of both parents is important. Don't expect the favored parent who has little to no insight to all of a sudden be masterful at understanding the developmental and psychological consequences to children, but it is an important piece, and you never know what nugget might actually be internalized by the favored parent. So you talk about the science, you talk about the research, the developmental and psychological outcomes for children. All of those slides that I just presented are important to discuss with both parents. Parallel versus co-parenting. That's another discussion to have in reunification. People advocate for co-parenting, but honestly, with alienated children and a damaged parent-child relationship, parallel parenting is important to consider. That's where mom does what she does on her time, dad does what he does on his time, and there's no communication back and forth about why are you doing this and my bedtime is 10 o'clock and Why are you letting the kids stay up till midnight and things like that? It's a starting point, but it keeps things very clean and it decreases episodes of conflict. Basic parenting skills, communication, triggers, and a new family model are essentially, in my opinion, the core starting points. All right, it's not all co-parenting skills, but there has to be a reasonable way to communicate. There has to be a way to manage your triggers. And the concept is a new family model post-divorce. The clinician can also help establish a better balance of power between the two of you. There's often a power differential, with one parent having significantly more power in the relationship. And that was part of the conflict that developed in the relationship and post-divorce. And then holding the alienating parent accountable. A clinician can also do that. So holding that person responsible for his or her actions is probably about the first time that this has ever happened for that person. These high conflict personality disordered people aren't used to that. They're used to using intimidation, hostility, bullying, etc., to just get their way so that they're not held accountable. So my final thoughts with everyone would be this. The goal in any of this complicated family work is to create the best outcomes for the children. We have science and research to help guide us and help us understand the potential outcomes for children, which are not very pretty. Targeted parents and clinicians alike have challenges in order to minimize the negative effects on kids. It's not easy work. I will say that it is not easy work, but when you do make progress as a clinician, it's very rewarding to see an improved relationship between the targeted parent and the child. It is possible to make progress. I want everyone to leave here with some hope, with an understanding that while there are challenges, things can be different and improved by including that favored parent in a deliberate, methodical, well-intentioned way in your path forward. So I appreciate the opportunity to visit with you and present this information. Thank you so much and best wishes.
Hello, I'm Dr. William Burnett. I'm a child psychiatrist and forensic psychiatrist in Nashville, Tennessee. I'm looking forward to the virtual international conference that will occur in October 2023. As you know, this conference is created by the organization Family Access, Fighting for Children's Rights. This conference has an interesting title, Alienation, the Truth Regarding the Trauma and Abuse. My own presentation is also somewhat provocative. It's called Truth or Dare, Strategies for Addressing the Epidemic of Parental Alienation Misinformation. One of the unusual aspects of parental alienation theory and practice is the huge amount of misinformation and outright false information that has been published regarding this topic. Over several years, I have documented parental alienation misinformation that was found in peer-reviewed journals, presentations at conferences for mental health and legal professionals, in books edited by psychologists and attorneys, in official statements by professional organizations, and even misinformation in a resolution before the United States Congress. It is impossible to spread the truth about alienation without identifying and counteracting the false and misleading information that is so widespread. In my presentation for the Family Access Conference, I will tell you about several specific examples of misinformation and also our attempts to challenge and correct these false statements. Most of these attempts to set the record straight regarding alienation have been successful. A few have not been successful, and perhaps we can learn something from both outcomes. I'm hoping that the listeners of my presentation at the conference will think about ways they can identify and fight the epidemic of parental alienation misinformation. I hope to see you then. Thank you for your interest in this important topic.
In our next episode of Families Divided TV, Bill Eddy speaks on confirmation bias in family court.